Hello, my name is Stephanie Libzon. I'm a pediatric physical therapist and a researcher. I will be sharing highlights from our work titled Parental MRI for the evaluation of fetuses with brain anomalies. Advances in neuroimaging and genetic testing enable an early diagnosis of fetal anomalies. However, next-generation sequencing is not available in many countries. It's costly and rarely subsidized, and have a relatively low yield for brain anomalies, what make a precise outcome elusive. In Israel, termination of pregnancy is allowed until the end of the pregnancy, when there is a risk of more than 30% for a severe neurodevelopmental disability. In such cases, a multidisciplinary approach is needed to manage these ethical dilemmas. Our team came across fetuses with brain anomalies, at times recurring in successive pregnancies, yet without a confirmed genetic diagnosis. The repeated presentation of these anomalies led us to hypothesize that an autosomal dominant disorder inherited from a healthy parent was possible. Therefore, we referred the parents for a brain MRI to investigate whether one of them had similar findings to those observed in the fetus. In many cases, we indeed found parental MRI changes that improve our counseling and reduce the incidence of termination. This retrospective study aimed to evaluate the role of parental MRI in assessing fetuses with suspected brain anomalies and its utility in prenatal counseling, and to define the indication in which parental MRI should be recommended as part of the prenatal evaluation. We included fetuses that had undergone an MRI due to suspected brain anomalies, with one or both of the parents who underwent a brain MRI as part of the counseling process, what we called trio MRI, for born children age of at least 12 months at the neurodevelopmental assessment. We reviewed the perinatal history, the family history of previous pregnancies, relative with developmental disabilities, were also examined. MRI trio concordant was defined as at least one abnormal brain finding identified with a similarity in the fetus and the parent. The neurodevelopmental outcome was defined as typical when the developmental was within the normal range, favorable when a mild developmental delay but similar to that of the parent, and atypical when a significant neurodevelopmental delay was present. 60 pregnancies met the inclusion criteria. MRI trio was concordant in 25 cases. 25% had a history of previous termination. Amniocentesis was performed for genetic investigation in 70% of the pregnancies. Pathogenic and likely pathogenic variants were found in 22%. The most common brain findings were multiple anomalies, followed by isolated disorder of the corpus callosum and PVPCs. 42 children were born, 17 underwent TOP, and one case had died in utero. 71% of the children had a typical neurodevelopment. 17% had a favorable, and 12% had an atypical. None of the children with a concordant trio MRI had an atypical development. Most of them had developed typically. 4 children were born with favorable development. They were born to parents with mild neurological deficits or other soft neurological signs. Some of them had learning disabilities. All had a concordant MRI trio. Tubulinopathies are diagnosed pre- and postnatally in 5 pregnancies with MRI trio concordance. This is an example of one case. A fetal MRI done in the 32 gestational age shows signs of mild tubulinopathies. In the sagittal T2, a thin corpus callosum and a flattening of the anterior pons. In the coronal T2, we can see dysmorphic frontal horn with asymmetric caudate, and frontal interdigitation. We can also see undeveloped left olfactory bulb and absent of the right olfactory. Similar findings are seen in the MRI of the father and of the MRI of the born child at 7 months. By utilizing the MRI trio approach, when the radiological findings are mild and observed in one of the parents with normal or mild disability, the risk for a severe neurodevelopmental tend to be lower. This is a high likelihood of a favorable prognosis, similar to that of the parent. We acknowledge several limitations. The sample size was moderate. The repeated presentation of brain anomalies in consecutive pregnancies could have introduced a selection bias into our cohort. Therefore, we aim to minimize it by systematically reviewing the fetal MRI database. Most of the children were assessed until the age of 24 months. Children exhibiting abnormal development receive an extended follow-up care. It is possible that children who had scored typically in infancy may have developed difficulty later on. And oppositely, children with atypical presentation may have caught up in childhood. Additionally, a standardized cognitive evaluation was not conducted. Our work highlights the necessity of a multidisciplinary team within the framework of the FNC. This study presents the additional benefit of MRI trio as part of the prenatal counseling. MRI trio has the potential to identify dominantly inherited brain anomalies that either may not hold developmental significance or have a favorable outcome. Acknowledging the potential of variable preternates, which might result in more severe presentations. We suggest that it should be incorporated into the pregnancy follow-up protocol for fetuses with brain anomalies as part of the multidisciplinary FNC. Concordant finding can enhance the accuracy of the prenatal counseling, potentially reducing the incidence of termination. Thank you for your attention.